HIPAA notifications. This is a really key aspect for most HIPAA sites. Whenever you look at a HIPAA project, you want to make sure that you're getting in touch with the users at the right time in the workflow. If you have a lab scheduling process, an appointment scheduling process, a online pharmacy, a e-commerce, any of these have the potential, as well as any other type of projects, to need to get in touch with the user and keep them apprised, give them a reminder, possibly get in touch with not just the patient, but also the care provider, and help to coordinate both of the sides of the resource to be able to deliver on the promised service. Now, ultimately, whenever you're looking at notifications with HIPAA, you really want to be able to offer the different users the ability to control the frequency of the notifications, as well as granularly modify this per type of notification and allow them to set the different mediums for being notified, whether it's text or email or through your system, your application itself, maybe a mobile device that we've set up, etc. So these are all of the different considerations. And then of course, on top of that, we have privacy and security. So we're here today to kind of unpack all of that with you and show you some examples so that you can kind of think about these and really toy with the different thoughts and how it's going to apply for you. With that said, let's get into it. All right, so just diving right in, we're gonna take a look at a portal system here that is white labelable. So the end user can actually get their own portal system for their covered patients that they're working with, and the different providers within their application, they have access to be able to kind of go in and provide care. Here we're looking at an actual patient. So here the patient has the ability to come in and modify their different notification settings. Now this is a pretty high level set of notification settings. You can see that they have the ability to get notifications via text, email, and through the portal system, and they can simply turn these on or off. Now it's also possible to be much more granular, and it just depends on your business model. What you don't want to do is you don't want to overwhelm the user and make it so they don't do anything. You also want to make sure that whenever you're thinking about the notifications, you're thinking about the different states and the different kind of statuses for these different kind of states in your workflow, where you're going to want to notify someone. Probably one of the biggest kind of misses that we see for a lot of clients kind of coming into working with our team is they haven't really thought about governance. And what do we mean by that? Basically, the idea is you want your application to be as opinionated as possible within a reasonable kind of spectrum, so that your users on both ends, both your kind of recipients of the services or products, as well as the delivery folks who are going to be delivering that care or delivering the items, etc. You want to make sure that they're kept informed and kind of put like training wheels into the process for them and make it so that it's flexible enough that they can actually operate within a reasonable range, but make it opinionated enough so that if they have an appointment coming up and they haven't checked in, you're going to start notifying them more assertively. If they have a update to their pharmacy order and they need to go ahead and do something in order to modify that, maybe the fulfillment isn't happening and they need to kind of know that they're not going to get their item in time. And maybe this is a serious medical condition that they have and they actually need to know about that right away. We've got to have that opinionated capability within the platform. And you're going to want to think about this from just a covered entity perspective. You know, how can you take advantage of notifications to help your end users get that self-service and that just kind of love for working with your application? Okay, so let's kind of keep digging in here. And one of the big things that we want to point out is whenever someone does get one of these notifications, you do not want to include any PHI information in that notification. In fact, we recommend basically making it a link, and that's it. Now, you're also going to want to, whenever that link is clicked, allow the user to get access to this kind of messaging type of system, basically review the notification in whatever format makes the most sense. But you're going to want to see the notifications as just being a link that they have to click on. And that way you're not really providing any sensitive information out there. One of the best words or phrases to use to describe this is a zero trust environment. You want to assume that their email or their phone or whatever method you're notifying them in has been hacked and compromised. And if you assume that, it kind of puts you in a position of taking the stance of making sure that you're not trusting any access that they have outside of what you can control. Okay, so once the user is accessing their dashboard and they've gained access securely in that zero trust environment, they're going to typically want to do a few kind of common things. Of course, they want to be able to go and look at the details of the message. Before we get there, they're going to want to be able to kind of quickly see a filter, the ability to see who sent the information, when it was sent, these kind of things, and the ability to modify or kind of delete an item. And of course, if they go and view the details, we want them to be logged in to the system to be able to do that. But then once they go view the details, we want them to be able to see and respond to the message. We'll take a look at a detailed view of that later, where they're actually going in and responding to that message. But kind of the summary overall with the notifications is we want the users to be able to control when they receive the different messages and via what medium they're receiving these message notifications. And then we want to make sure that it's very secure and a zero trust type of environment. Now let's kind of go through a few more examples here where we can kind of look at some of the notification types that they're going to receive. So you can be thinking about that as well. Okay, so in this particular example, this user is seeing their inbox and they're also seeing in-stock alert notifications. Now for this particular pharmacy, this is an online pharmacy, they have the ability to interact with the user and they can put the subject into this kind of messaging area. The user can mark the items as read, delete them, or click on them to view more detail. Whenever they go in and view the detail, they can see the detailed message. They can also respond here. And they have the ability to, whenever they respond, they can use HTML if they want, just basic HTML. Of course, it has a WYSIWYG editor in place. This can just be text-based if you want, or it can be a WYSIWYG editor. Folks can attach files if needed. It's really up to you as far as how much detail we're going to include. And most of the time, what we want to recommend with these notifications is that any kind of access to details is linked to other parts of the application. So within the message itself, we want to link to, and typically we're going to use tokens to do that, to other parts of the application. So if you're using this and the doctors are going to be able to notify the patients whenever the patients are rejected for a refill request, for example, we want to have a tokenized link in that message that allows the user to go in, log in, see that, oh, I have these different notifications, I need to go click on them, they view the detail, and then they can then click on the link, takes them to the part of the dashboard where they can see that detailed reason why the doctor or pharmacist rejected their refill request. Maybe they need to go back in and complete another lab test or etc. in order to get that prescription filled. So that's kind of an example. And if they want to make a message, they can compose a message. So maybe they're going to send a message. Whenever they do that, they can select only from a kind of preset list of folks within that organization that they have access to message. So typically this might be for their kind of pharmacy application. It might be a customer support rep, a doctor or pharmacist that's assigned to them or associated to them. If we're doing this with a kind of online setup where it's a bulk ordering, it may be the sales or account person who is associated to that account. If this is for an in-person lab test, maybe it's going to be a message to the customer support team or to the lab technician who's coming on site to meet with them. Maybe that particular test, they're not going to be able to make the appointment and they want to send a message to let them know. Now, these are just kind of basic scenarios that we're talking about. We're asking you, in this case, to really think about what it might be for you. With your particular practice and with your workflows that you have, what would be the kind of logical use case for these notifications? And in specific scenarios where the workflow breaks down, where somebody is kind of going off of the rails and headed in a bad direction, what kind of messaging do you want to provide to them? And what are the triggers? And how do you want them to be able to kind of be guided back toward a good path within the process? And again, keep in mind, this includes not just the patient, but also the caregivers or the providers of care within your system. Okay, and then the last thing we wanted to point out for this example was notifications doesn't just include sending messages. They can also include notifications within the site itself. So in this particular scenario, you can see that the user is trying to navigate to get access to a URL that they shouldn't, they just don't have access to actually. In this case, this is an online pharmacy and they don't have access to this particular product because this product is only available to certain folks based on their jurisdiction or their state in this case. So we're letting them know, hey, we see you're logged in. We see your shipping address is, New York State, for example, and you can't actually get access to these products. So here's a message and you can contact us if you need any support. Okay, so let's take a look at a few other examples of these notifications. Now, this particular view, you can see that we're going to be providing in-stock alerts. This is kind of interesting because maybe there's a lab test or some kind of a testing process or items that are in stock. Pharmacy, it could be physical items. We want to notify the patient that they are back in stock. They also, in this particular case, will notify about tests, prepping for tests, actually conducting the tests, and then after the test results. So again, we're going to want to tokenize these kind of things so that whenever the user is reviewing that detail, they're going to be able to click a link and go to the appropriate page within the dashboard. We don't typically want any sensitive information to be contained even within the messaging within the site. We really want to try to kind of quarantine it to the respective areas as much as we can. The other thing that we'll point out is this site has schedules. With schedules, it's a really good idea, especially if it's a telehealth type of an appointment, for example, to make sure that you are messaging the users and getting their permission to do this, but message them pretty assertively so that they show up. A lot of them are just busy and they forget. And so this can be really expensive if people forget or if they're not prepared for the meeting. Sometimes the technology can take a little while to set up, so we recommend having them even complete a checklist and certifying and saying, I've done this in advance of the appointment. This can be helpful not just for the patients, but also for the care providers as well. So we recommend kind of thinking about this as you go through the process. And this last example just kind of speaks to that. So whenever we're going through the checkout process for this particular project, we're actually showing the user that they should expect to go through a telehealth approval before their items are even going to be fulfilled. And so this can be really helpful to manage the expectations of the user. And we're also going to be kind of setting their expectation that they're going to need to talk with somebody via this telehealth process in order to get access to their items that they want to, in this case, take a test with. So this is really key for the user, is giving them this kind of expectation management about the notifications. Now they know they're going to have some kind of a notification about working with this telehealth provider and getting access to the kind of meeting itself, scheduling it, getting an appointment, going through all of that process. So this is really something that we want to encourage you to think about, again, for your particular scenario and some of the different nuances. Ask yourself the question, if I was the patient or if I was the care provider and I was going through this scenario, and try to think about all of the edge cases, what kind of notification or what kind of communication would help me to really be my best in this process? What kind of information would help me to feel really comfortable with what was going to happen next? Okay, with that said, we're going to kind of wrap up with talking about next steps in the process for going through a complementary discovery and accessing other resources that we think might be helpful. Okay, so one of the big things that we want to point out is that if you are interested in getting a complimentary discovery, this is something that we specialize in. It is a free, no hassle way to interact with a very qualified kind of focused team that really specializes in Hipaa. And we provide this with no hassle and no cost. It's a 1 or 2 session long strategy discussion where we meet with your team. We bring one of our specialized business analysts who has worked on literally dozens of these Hipaa projects. Across our team, we literally have decades of combined experience working on implementing and maintaining and growing Hipaa practices and Hipaa projects with our clients. Now, ultimately, you're welcome to work with whoever you think is best and take all of these resources that we provide complimentary and bring them to those projects. We just encourage you, if you don't already have a great solution to be able to answer a lot of the questions that you may have, why not take advantage of a complimentary discovery process? The other thing that we want to encourage you is to take a look at some of the other resources we have, both in this kind of set of resources within our videos, as well as some of our checklists and master classes that we provide on our website, clarity-ventures.com. With that said, if you enjoyed the content in this video, if you would give us a like, we certainly appreciate it. If you're interested in hearing more or finding out more about these topics, go ahead and hit the subscribe, and we'll make sure to notify you whenever we have more content about Hipaa. Thanks again for watching, and we will see you in the next one. Until then, bye for now.